Hello students, myself Dr. Vandana Kumari. In this lecture of Roga Nidan, we will discuss Chhinna Shwas Lakshan. Before we go ahead, we must know what is Chhin. Chin is break in any rhythm or pattern. So Chhinna Shwas is in our regular breathing pattern when there are phases of no breathing at all. That is Chinna Shwas. Chhinna Shwas Lakshan goes like this. यस्तु स्वसिति विच्छिन्नम सर्व प्राणेन पीड़ितः न वा स्वसिति दुखार्तो मर्म छेद रुग अर्दितः. A chinna shwas rogi or a patient has a typical breathing pattern, that is vichinnam, that is there is a phase of no breathing at all for a small period. Sarva Pranen Pidita, I would like to bring your attention on the word Sarva Pranen because different scholars have different school of thoughts for this word Sarva Pranen. On one hand, like in Charak Samhita, Sarva Pranen word means all type of vayus, all the 5 type of vayus what we have in our body, those are vitiated. Whereas in Madhav Nidana, Sarva Pranen means patient is using his whole strength. So we can take both together and the symptoms become that the patient is using his all strength to ease his breathing and therefore his Sarva Prana are painful. Nava swasiti dukharto marma ched rug ardita. Marmached Rug Ardita is the symptom where it means the patient experiences acute pain in his vital regions. And the pain is as if there is incision, chedan of his vital organs. The type of pain has been mentioned that Marmached Rug Ardita. The patient feels as if his vital organs are being incised. Anah Shwed Murcha Arto Dah Manen Bastina Viplutaksh Parikshena Swasan Rakt Eklochana. The other symptoms are that Anah is distension of abdomen, Shwed there is excessive perspiration, Murcha patient fall unconscious या फिर unconsciousness. Dah manen bastina. Before we understand this, I would again like to bring your attention here that daha is because of vitiated pitta. This is only kind of shwasa where we find involvement of pitta dosha, and we have the symptom of daha, burning sensation in bladder. विप्लुत अक्ष परीक्षीण स्वशन एक रक्त एकलोचन. Viplut aksh is excessive lacrimal secretion from his eyes or watering of his eyes. Parikshina swasan. Parikshina swasan is shallow breathing. This is breathing is so shallow that it appears as if there is no breathing at all. Therefore, we termed it as chin. Otherwise, there is very shallow breathing. Rakta eklochana is reddening of one eye. Next, Vicheta Parishushka Asyo Vivarna Pralap Narah Vichinna Shwasen Vichinna Cha Shigram Prajahatya Shun. If Chetana is consciousness or alertness, then Vicheta is patient is not conscious or alert, or we may say patient is not oriented to time, place and person. Parishushk Asyo, that is dryness of mouth. As we can understand, in case of breathlessness, patient tries to breathe from his mouth, therefore there is dryness of mouth. Vivarna is change in natural complexion or glow of skin, loss of glow of skin. Therefore, we have Vivarna. As we know, in prolonged illness or in acute disorders, there is change of complexion. Pralap Narah is patient talks irrelevant, but we may understand it as in case of breathlessness or in case of no breathing at all, patient is wailing for breath, or as we say, there is acute pain in his murm areas, therefore patient is wailing in pain. Chhinna Shwasen, Vichinna is the rogi or patient of Chhinna Shwas has acute or extreme weakness in his body. Therefore, another again repetition of word Vichinna, the patient feels the loosening of all his joints, Vichinna. Because, or we may understand it as that there is extreme weakness because all his strength is used into breathing. Therefore, the person feels as if all the joints are loosened. Shigram prajahate suna, with such symptoms, patient has very bad prognosis and patient dies soon. Iti Chhinna Shwasaha. We can conclude these symptoms as follows. Breathing is not regular. There is transient phase of breathlessness. Patient uses his full strength to breathe. Therefore, loss of energy and excessive weakness. Patient feels intense pain in vital regions like heart or chest, distension of abdomen, excessive sweating, loss of consciousness, burning sensation in bladder, watering of eyes, reddening of unilateral eye, altered consciousness or alertness, dryness of mouth, loss of natural complexion, irrelevant talk or wailing patient. Such symptom develops in terminally ill patient. Such patients die soon. Thank you, students. Keep studying. In next lecture, we'll discuss Tamak Shwas Lakshan.